United Nations has given 17 sustainable goals. Out of that, we are taking 3 today. So I'll be telling you now, first thing I'm going to share with you is about the neighborhood communities Minister for Good Health and Well-being. This is the goal number 3 out of the 17 sustainable development goals set by United Nations. So it's me, Ravisankar, President of Neighborhood Community Network and BNC movement here, Basic Neighborhood Community Movement. So here I am to present you the 3rd goal, that is good health and well-being. For that, I would like to ask you, how many of you really want to have a good health and well-being? I think everybody, right? Everybody wants to be healthy and be well, okay? So everybody wishes also other people all the best life, okay? So this is the not just United Nations requirement, this is everybody's requirement in the world. So here we are to share with you how we can go ahead with this proposition, okay? So let us understand the importance of good health and well-being before we go into the topic, okay? So here I am going to present you through some slides here. Let us understand each one of them and then move by it, okay? To ensure healthy lives and promote well-being for all at all ages, this is the most essential thing for the whole world. Okay? And then the next thing is feelings of well-being are fundamental to the overall health of an individual. It's not just human, because human beings cannot live separately from the rest of the world. So it is an overall, means everything, fundamentally every being requires good health and a well-being, right? And enabling people to successfully overcome difficulties and achieve what they want out of life. If you are healthy, you can definitely be successful. Health is the most basic requirement to be able to be successful. Many people, they have very great intentions, highly talented, worked hard, but when their health deteriorates, everything collapses. Brilliant people simply left the world because of some health conditions. So being healthy is our primary need. That's why, you must have seen our Prime Minister of India has proposed yoga as one of the most important processes to make the world a healthy living, and a fit world. Okay, this is what we want to have. And if you look at it, what really affects our health is some of the past experiences, and our attitudes and outlook. All these things are affecting our well-being. So we need to look at how do we really overcome those past experiences, how do we adopt such an attitude that is healthy, and also an outlook, like how do you look at life. If you change these things, it will definitely make our life a very beautiful life. Because we think health is only physical. It is not just physical. It's also mental or emotional and social, also economical. So economics also comes into picture. Financially, people who have been simply have lost their lives. So this being the most important ministry, of course, all the 17 goals are important. This is something that really holds all the other ministries. That's why we have taken up this good health and well-being as the most prioritized thing. So what are the benefits of being healthy living? If we look at it, then our goals are set. The first is feeling better mentally. That means regular exercise can lift your mood up and help you feel better. So it can be physical exercise, it can be mental exercises. These things will make you feel better, both physically and mentally. This is what happens when you gain health. Also, if you are healthy, you save money. We spend a lot of money eating junk food, smoking, drinking sugary drinks, and alcohol. They're all expensive habits. People, I see a lot of people, even the poorest people also, instead of food, they take alcohol. It's very pathetic, you know. So they save money on food and smoke. They save money on, education and go for such habits which deteriorate their health. So if you really save money, it should be towards your health. Saving money is health is also saving your money. When you are healthy, you don't have to spend money on hospitalization, medicines, everything, right? And you will have fewer health problems. Means living a healthier lifestyle means low risk of developing many disorders. So if you are really fit and you are doing your exercise, you are getting good food, if you are doing all these things, definitely you will have less risk of many disorders. And then health is a positive concept emphasizing social and personal resources as well as physical capabilities. Healthy is not just you being healthy and happy. When you are healthy, automatically you are a resource for the world. So every person we have to see as a great contribution to the world. And Sharira Madhyam Khulu Dharma Sadhana. If you want to achieve something great, something noble, first and the foremost thing is to keep yourself healthy. This is the most important thing required. So this means that health is a resource to support an individual's function in wider society rather than an end in itself. Okay, so I hope you now understand how important and beneficial it is to live a healthy life. So a healthful lifestyle provides the means to live a full life with meaning and purpose. Hope you all agree with me, right? So how basic neighborhood communities, this movement, plays a key role in this. We are promoting this. Why we are promoting this neighborhood communities? Because it plays a very key role in building a healthy society. All infections usually start spreading from a neighborhood only. Okay? So if your neighborhood, if you are from one to another person in the neighborhood, that's how it spreads. Okay? And an alert and active neighborhood can prevent and attend to any epidemic. The moment people become aware, yes, such a thing is happening, let us be careful, let us keep ourselves like this. If you take some preventive measures, it will immediately stop the spread of that epidemic. Also, a well-lit neighborhood, if there is a good relationship among the neighbors and we meet it regularly, it can build better awareness also. It's very easy to communicate and let people know and able to take immediate steps to stop. It will not make it spread over and then becomes very difficult to handle, and then you have to bring big machinery, a lot of deaths, a lot of casualties, so many things need not happen. So it is easy to distribute medical help in a network community. Do you agree with me? If we are all connected in a neighborhood, it's very easy. If anything is required, information can reach, medicines can be given, treatments can be given, all these things can happen. And also it's very easy for people to start, practicing, yoga, such kind of exercises, everything together in a community, very easy. And at times of medical emergency, who will come to your rescue? It is not your brother or sister in some other place. It's your neighbor who can come for help. All of a sudden, one day I heard my neighbor in the night, 1 o'clock, a big sound and with a big moaning. Then I thought something happened. And I saw the light in the bathroom on and I could hear some sounds coming, oh, help, help, like that. But their gate is closed. Then I woke up my another neighbor. I said, do you hear something? Yeah. So shall we take the risk of jumping over the compound and go inside? We both decided, we jumped over the compound, inside we went and we banged the door and then it was open and we saw that lady collapse in the bathroom and they were not able to lift her. Then we two neighbors helped, lift her, put her on the bed, and helped them, console them. Don't worry, we are here. We'll take care. We were there for a while. And then once she became conscious, they were all settled. Then they said, if not for you, we would have really been in a mess. I said, yes, definitely. It's the neighbors who will come to your rescue. So we say, neighbor Devo Bhava. That means your neighbor is God for you. Okay? So a healthy environment is easy to maintain with neighborhoodization. So this is what our principle is, neighborhoodization. We have got urbanization, this kind, and then we have to build a good neighborhood, a well-lit, well-organized, and those who know each other pretty well to support each other. So this is our primary need in the whole of, the things that we are doing in the world. Okay. So NCN movement, the Neighborhood Community Network movement, is a must in these pandemic conditions. Am I right? Yep. Thank you. Okay. So now you understood all these points. So NCN, how does it work? How does basic neighborhood communities movement work? Let's understand this. First, we have to do neighborhood parliaments. We have to bring people together to understand and form a platform. It's called parliament. So neighborhood parliaments are formed with a group of about 20-30 families in the neighborhood. We don't spare anybody, everybody is included. And out of these 20-30 people from each family, a minister for good health and well-being is to be elected. That community, where that neighborhood will decide who will be the right person for this particular role as a minister for good health and well-being. It is not something somebody appoints him, but it is the whole group decides who is the right suitable person. So this is how the election happens. It's all done in a socio-critic way. It's not on a democratic way, how many people and that kind of thing. It is choosing the best among everybody for a particular role. And the minister will survey the neighborhood. Once the person is elected as the Minister for Good Health and Well-being, his role is to first survey the neighborhood and collect the information of health, regarding health. What kinds of diseases they are there, how many sick people are there, what facilities they have, what facilities they require. So these kind of things the minister will go find out, so that we will come to know what exactly is the health situation in that particular neighborhood. And minister will locate the medical help available for various diseases. So they will find out, in case such a thing arises, where we have to go. Where do we get the best support? What should be the step for this? A lot of people I found when this COVID came, they don't know where to go. They thought it is normal fever and they started doing something until it came to a point where they cannot breathe. Then they don't know where to panic and they call and these things. So much of a big hangama. When they do it, when suddenly neighbors feel they are left out. So when this kind of a clarity is there in the neighborhood minister will arrange for the help, will make sure that everybody is given proper support and treatment. So he will keep updating the essential health conditions of the neighborhood. So everybody knows who has got what kind of support they require at what time. There is one saying that health, is not to be hidden. Health problem is to be exposed. Rogam Raddu, they say in Telugu. That means it should be out. Then only people will be knowing, you have this problem, somebody has got epilepsy. So previously people used to carry something to say, a small nameplate, something like, I am epileptic. In case I fall, please help me. So if suddenly they fall, they know what to do immediately for him. So similarly, if anything happens, everybody knows he's a heart patient, so we should talk to him carefully. Okay, he has got high BP, we should be, helping him to come down from his emotions. So like this, when you have this awareness in the neighborhood, people know how to really encourage, support, and also make sure that they are given proper help at the time of need. So this can be done with this. And then this minister will represent the neighbors for medical help when needed. So he will approach the proper authorities to get medical help, whenever it is required. Because this is how every neighborhood is well equipped. BNC movement will help every neighborhood very well taken care of. And what are the processes adopted by Ministry for Good Health and Well-being? I'm going to tell you. Okay. So first thing is to build awareness of health measures needed in the community. That means everybody in the community are aware of what to do, when and how to handle the situation. So people are, unless it requires a medical need, most of the health situations are taken care as locally as possible. So this is what only the awareness of health measures. Second thing is keep the mental and environmental hygiene in order. So this is also very, very essential. So this is one of the processes where we make sure that people are confident. I saw in the last COVID situation, a lot of people died not out of COVID, but by the mental stress they went through. So it is also the mind that acts. So a community well caring for each other will definitely make sure that the mental hygiene is in order, environmental hygiene is in order. So in case, for example, you require sanitization or something like that, can all be taken care by conducting workshops, training members in first aid or old age care, mother-child care. These kinds of things can be given. Hope you remember a generation back, like I am born at home. I'm not born in a hospital. Because who came to help my mother for delivery? Neighbors came. When she got pain, everybody came and they helped, and then my mother could comfortably deliver me. I am the seventh child of my mother, and she has delivered all the 7 children at home only. With a small help, because people knew how to really help a woman for delivery. But now, many women don't know what to do. They say it's medical job, like they have to go to doctor. But if people are trained to handle these things, every community, every neighborhood will be strong enough to take care of most of the health needs. And then monitor measures like face masks, sanitization, social distancing. All these things cannot be done by policing. It can easily be done by a neighborhood when people are aware. No need for somebody to police them. Okay? Like a few days back, I had to leave somewhere in an emergency. I forgot to wear my mask. I was on my vehicle. Then my neighbor said, I said, what? Mask. Oh yeah. Then I went inside, got my mask. See, this is because we care for each other. We care for our neighbors. Because we know each other, we love to be, concerned about each other. So communicate between the health authorities and the communities, another process, very important. So once there is a Minister for Good Health and Well-being, they take up a responsibility of the whole team, whole parliament, to make sure that proper health, information is reaching them, everything so there is a communication that is required between the health authorities and the community. So this will be bridged by the Minister for Good Health and Well-being.
Raviji, sorry to interrupt. There is some sound coming from your room, I think. Some noise, yeah.
Sorry.
Go ahead.
Sorry. Yeah, I'll continue. No sound, or any sound still coming?
No. You can, carry on. Go ahead.
Thank you. Yeah. So, the minister can engage medical department in providing adequate health care. So, so medical department wants to see that everybody gets, health care. But we have got a very small resource for a huge number of people. So they require more hands to do this. You must have seen, especially in this epidemic, you must have seen such a big need, very less facilities. But many things can be taken care, provided you have got a neighborhood communities which will come in hand and they say, we will take care of these basic things. Then it's very easy for any government or any kind of a thing to work comfortably for, developing a nice community. A medical department can do proper care for the community. Department can do, timely, and people who really need it will get it at the right time they need it. So this is how the processes adopted by Ministry for Good Health and Well-being will be able to provide. Okay. And what this minister is doing is he is representing the community. He or she is doing this. So animator like you will be training the minister, that means the person who is going to represent this particular health, health minister, to prepare health reports of the neighborhood. How to prepare health reports. Animator will train the minister in that, like that, make different tables where you'll have who is who, what is their age, what kind of ailments they have right now, what kind of treatment they are taking, what kind of medicines they require. All these things to a large extent, about 20-30 families report is prepared. And then communicate with health authorities for needed help. There is somebody with a heart condition, so they are monitored and they are, taken care. So this is very easy. Like I tell you, one of my students wanted to come and attend one of the programs here, but she cannot leave home because her father is not well and somebody has to take care of her father. But that can be taken care if in case there is a neighborhood community there and neighbors say, don't worry, we'll take care. That's how I lived all through my life, because we have a very good neighborhood. Whenever I have to go out, I'll call my neighbors, say, I'm going out, I'll not be available for 3-4 days. They say, don't worry, we will take care of your problem. So this is how, this kind of a help is provided, and they can, if there's a minister particularly for health, they will communicate with the health authorities for any needed help. And communicating intra-parliamentary departments to coordinate is also important. For example, there is one community here, the parliament is made, and there is another parliament in our neighborhood, another neighborhood community, So in case there is some kind of a problem you are seeing with the other neighborhood, but you don't have, you may apprehend that it may, affect your community also. Then these two ministers of this, health ministers, can sit together and find out how to prevent it spreading out everywhere. So this is how intra-parliamentary, coordination can happen. This is very fast and this will happen within no time. And also, like, for example, this is, we have such a health problem that it is spreading everywhere, for example, that way. Then there are these parliaments at the lower level means at the local level, maybe street parliaments, neighborhood parliaments at the street level or maybe ward level. They have a problem in the higher level, like panchayat level. Then these ministers of each parliament will sit together and they will, communicate with each other, find out how that whole panchayat can be taken care of. Or the panchayat level, ministers for health will sit together of different panchayats and decide over the taluk level. So this is possible when we have got a beautiful network of all this, these basic neighborhood communities. Okay, so conducting camps for health and wellness awareness, this is to be trained, because people don't know many times, like why, unless they come to their problem, they will not think of a doctor or medicine or something like that. Even when people were told a third wave is coming, people don't care. People, they are not aware. So we have to conduct camps for health and wellness awareness. This, how to conduct these camps? We have to train this. Our ministers for health, the animators have to conduct this kind of training for a minister to conduct camps. And like a vertical move, I was just telling, like federated parliaments, lower parliament ministers to represent at the higher level, and those ministers at the higher level. Like that, it can be connected and communicated for the whole world also. It's possible once we have at the basic, neighborhood communities. They have to be networked and federated to the next level. And distribution of health-related materials to the needy in the community. For example, right now they are giving vaccination. Today we have got a very cumbersome, process, because we don't know who needs it, who doesn't need it, and all that. Everywhere we require recommendations, these kind of things. And people who need it may wait for a long time. So this distribution of such kind of materials or anything can be done very easily when we identify the neighborhoods which are organized with a minister. So the minister for this health is to be trained in how to distribute health related materials to the needy in the community. This will be trained by the animator. Okay, so with this we are able to really handle this very well. Okay, hope I have cleared myself with respect to this ministry. If you have any questions, we'll come to it at the end of this session, because I have another 2 things to cover. After those 2 things, the common questions will be same. So we will come and clear those things at that point. Was it okay? Shall we move to the next point? Yep. Is it fine? Okay. That's nice. I'm not able to see many of you. Let me come to the next thing about Minister for Clean Water and Sanitation. Okay, I think clean water and sanitation is the third one. Further, shall I go? Is it okay to go for the third one now?
Yeah, okay, no problem.
Yeah, okay. Just happened to open that. Okay. Basic Neighborhood Community Minister for Clean Water and Sanitation. Presented by me now. Need for clean water and sanitation. This is 6th Sustainable Development Goal, of United Nations. So most of the diseases we find are waterborne. Many of the because of the contamination of water, many virus and other bacteria, fungus, lot of things, including the deficiency in minerals, is also caused by the water that we are drinking. Did you know that 2.2 billion people globally do not have access to safe water at home? 2.2 billion means 22 lakh people. They don't have access to safe water. Sorry, billion is 22 crore people, not lakh people. Okay, sorry. Okay, yeah. Many people have no access to sanitary toilets. Many homes, they don't have toilets. And many women are not able to afford sanitary napkins for their healthy needs. And we are now buying water for drinking. The processes we adopt for cleaning, they are also highly taxing on the environment. To produce 1 liter of, reverse osmosis, which is the water that we drink, you have to waste almost 7 to 8 liters of water per liter of drinking water. So how much it is taxing on the environment, we have to understand. And lack of sanitation is spreading the infections like malaria, diarrhea, allergies, and even COVID-19. Okay. Then 40% shortfall in freshwater resources by 2030, coupled with the rising world. World is, means the population is increasing, water is depleting. This is what is happening. So the rising world population has, we are going to have a water crisis. This is being predicted by 2030. If we don't wake up now, our next generation definitely, if not we, it's not too far also. It's already 2021. Another 9 years, we may be facing water crisis. So clean water and sanitation is very, very essential. That's why global, sustainable development goal number 6 is to ensure access to water and sanitation for all. Just a few weeks back, there was a big fight between two states, Andhra Pradesh and Telangana, for water. Probably shortly we may have a lot of fights, like we keep hearing about Karnataka and Tamil Nadu having water problems, like, fights for this. So it is between two states. Maybe later it may come to two, people at, every place there may be a fight. Tanni, they say in Tamil, we know that, in movie we have seen how much people, used to fight for small amount of water. Because water, our body contains 70% is water. Okay, so water is very, very important. Clean water and sanitation for all. We have to ensure how. So we have a ministry at every basic, neighborhood community for this water and sanitation. There's one minister for this. The ministry is for clean water and sanitation and dedicatedly for this particular goal. So they will find out the water resources available, prepare report on the water demands of the community, calculate and provide solutions for scarcity of water and water recharging also, and then inform and take help from government authorities for the needful steps, and make people aware of the misuse of water and sanitation processes. We spend so much of water every time you go to toilet and flush, so much of water is going. And every time you drink a little water and leave it, that much water is wasted. You have not utilized it. So like this, lot of water, we are just leaving it with the drainage. If fresh water goes into the drainage won't become fresh. The fresh water becomes drainage. So we need to understand how to really make people aware of the misuse of water and sanitation process and implement the existing government policies in the community. Okay, this also, there are so many policies, government, central government, state government, every level they have got a lot of policies, but it is not implemented in the community in the lowest level. So there is always a water crisis because it may be a big ship, but a small hole at the bottom is enough to sink the whole ship, right? So this is what the problem with water. So what does the animator do and train the ministry? First thing is mapping the water supply and sewage drainage in the community. The minister will see how many homes are getting water supply from the municipality or from the panchayat, or they have their own water resources, and how many borewells are there. Like this, a mapping is done. And also sewage, like, where the water is coming and then how it is going, where it is, exiting, all these things, and, a mapping is to be done. This is the job of an animator training the minister to do. And build data of the needs of water supply and misuse. So he will have a very clear picture of how much and everything, like water requirements, how much water is used, how much water is wasted, how much water will be demanded at each different seasons, all these things at particular events. So what is the misuse happening, how to stop it, all these things. And reports on sanitation measures needed in the community. This is also being prepared by the minister, helped by the animator. And bring awareness of rainwater harvesting and save water. Lot of times we get good rains. Now it is a good rain going on. We feel very happy. There is a good rain, but unfortunately, all that water is simply, washing our soil, taking away all the topsoil, and going and reaching the oceans, leaving us helpless. So, if the same rainwater is harvested, stored, it can recharge our, underground waters. So, how to save water? This is to be told. This awareness is to be built. Then conduct training and build sink pits for water harvesting. I don't require your help now. Please. So, when you really harvest this water, we are saving a lot of water. Like right now, I have got a rainwater harvesting project at my home. We get the water collected just on our terrace during rain. It goes through a filter and it charges my borewell. Now I will never have any more drying of a borewell. Now all my neighborhood is taught about how to do this, how to recharge your borewells, how to preserve this water in your, sumps. So this is how it saves a lot of water. Now people feel confident we have enough water. At one time we faced crisis with water. Today we don't have a crisis because a good neighborhood, a good awareness, a training, conducting this training will all help people build, their own measures to preserve water. Then build human resources for community water conservation and sanitation. Because we require some human resource. That means, like for example, in a small village, I have started about 90,000 borewells are recharged by our initiative. So when we did this, it was very cost effective. It is nothing. All that was something around for about 4,000 or 5,000 rupees. Your borewell permanently has got recharging facility. People come together, they dig the thing required for the borewell and then they charge. Everything is done. The human resource is there and available. Okay, so it makes it very much cost effective. And provide water testing and groundwater resources available. All this can be done by the minister there, so that we know what kind of water we have. If there is any excess amounts of minerals or lack of minerals, all these things can be studied. And water, whether it is usable, drinkable or not, what purpose it can be done, can be used for. All these things can be properly measured if we have a minister or particularly for this water. Okay. Then resolve issues related to water sharing. Sometimes there will be a problem with the sharing of water in a well, maybe between two states and a river, sometimes with anything, tanks, anything like that. So this can be easily be resolved if there is a minister particularly for this, and animator will train how to resolve these problems. So it is the people and the neighbors to solve. This we should remember. Okay, it is not somebody, third person cannot ever help your problem solved. If there is a problem between me and you, we have to resolve. So how this may be possible, I'm telling you. We may be either lacking water or misusing. This is the problem. Both are to be addressed as locally as possible. You cannot bring some rule somewhere to here. You have to see what actually is the need there, and people have to understand and support each other. Every individual has to be aware and contribute to the water conservation. Once everybody conserves water, I tell you, you may never require water from outside or any resource from outside to support you. So policies made by the government need to be looked into with care by the people, because government makes good policies, but if people don't understand, it will be a waste. So that's how, neighbors should be more aware. The policies are to be made with the people's consent. Even while making a policy, government has to make sure that people's consent is there. If it is people's decision to have a particular policy, there is every chance of it being successful. right? So all such issues faced in distributing water and saving can be resolved with people's participation. Okay, everything can be solved if people actively participate. That's why a neighborhood community is very, very important. Neighbors can build common conservative processes because each place requires a particular way to conserve. So sometimes it may be like the drainage water that can be cleaned and used. Okay, like that, so many ways we can really take care. Like if you see in many of the Gulf countries, they are taking seawater and convert it into drinkable water. It's because of the technology they have developed. So such indigenous technologies can be developed to make sure that everybody has got good water to drink and use for any other purposes. Manage wastewater in a profitable manner. So if you really, what we see as a waste is really not a waste. If you can really process it properly, the same waste can be a great resource for something else. So this can be done at the neighborhood level itself. So BNC is the solution for clean water and sanitation. BNC, with its Minister for Clean Water and Sanitation, implements every measure meticulously. Okay, so basic neighborhood communities are meant for this. And cooperation in such matters can be called for by the basic neighborhood community than by the government officials. When government officials simply come and announce this you have to do and all that, people will be looking like they are forced to, or they are being dictated upon. But it need not happen when people come together and make a decision. Government officials will also feel comfortable in implementing these things. Water can be saved and conserved in a BNC by people's active participation. And a regular checking on water usage and time-to-time monitoring is possible. And leaking water pipes and taps can be immediately stopped. I have seen this in a village when we made children's parliament. Children have seen how many taps are leaking. They went and plugged it and they brought some proper things to fix it. And I have seen that within no time, they are all not taken care. So providing drinking water to the community is effortless. Okay, then this clears our picture about how basic neighborhood communities will really help in developing, clean water and sanitation for the community. Okay, and the third thing that we are going to look at now is Ministers for Quality Education. Okay, I'll just brush through it. It is not a everybody is very much aware about this, so it doesn't take much time, right? This is the fourth goal of SDG, that is Sustainable Development Goal of United Nations. Quality education. What is education? Education is not just going to school and get certification. It is to build a life based on living values and to be more aware of oneself and the surroundings, about oneself and the surroundings. And it is the ability to respond to the needs with a vision in mind. Okay. It is to learn and update oneself of the changing world. It is to challenge and meet the challenges for development needed. And it is to include and expand one's relationship with the world around. So does present education system provide such quality? You have to see by yourself. Okay, the students are facing the world of corruption contrary to what they learn in the schools. They study something and when they come out, their qualifications are not much taken into consideration. And the students feel like very much depressed. Teaching is making students dependent on the system. Today, the methods of teaching that they have adopted are making students wait for the teacher to teach, rather than they go and learn and venture. So students have no freedom to choose what they want to learn. Today there are fixed subjects. You must do this, because that is decided. Instead of children Students having a choice over what they want to learn. And education is an expensive process, making the rich to be richer. Because it is such an expensive thing. If you want to be a medical doctor, you have to spend so much of money. If you want to be an engineer, so much. Like everything has got a price tag to it. And then higher one is educated, lesser concern that is about the society. Anna Hazare says, Anna Hazare, he says, if a village student is highly educated, he will leave the village, go to the city. If the city student is educated, he will leave the city and go to a metropolitan. If a metropolitan student is highly educated, he will leave the country itself and serve somewhere else. So higher education, most selfish you are. So competition and selections are breeding enmity and selfishness. Okay, quality is measured by the business perspective of the course. This is another problem. Today we think high quality means, no, they should have an AC classroom, they should have this, that, but okay, fine. But that is not the real quality of education. The quality of education has to make the child face the world courageously and bring something that is really worthwhile in their lives, okay? Need for quality education as per SDG 4 is like this. This is the goal. By 2030, all girls and boys complete free, equitable and quality primary and secondary education, leading to relevant and effective learning outcomes. I don't know whether you are able to see that by 2030, is it possible? Second, by 2030, ensure that all girls and boys have access to quality early childhood development, care and primary education, so that they are ready for primary education. By 2030, ensure equal access for all women and men to affordable and quality technical, vocational, and tertiary education, including university. By 2030, sustainable increase the number of youth and adults who have relevant skills, including technical and vocational skills, for employment, decent jobs, and entrepreneurship. By 2030, eliminate gender disparities in education and ensure equal access to all levels of education and vocational training for the vulnerable, including persons with disabilities, indigenous people, and children in vulnerable situations. So these are the 5 goals they have set for quality education by 2030. How do we make it possible? In the present situation, whatever we are seeing with the system that we are adopting, somehow I am not able to see how it is possible. But if you really adopt this with the BNC, basic neighborhood community, networks that we have, it is possible. I will show you how it is possible. Every neighborhood will have a minister for quality education. That means every 30 families will have one dedicated minister for quality education. And then they are trying to identify what is the quality of education present. They will identify what is the present education quality. And they will prepare the reports pertaining to the neighborhoods. In the neighborhood, they'll say, how many students are these, what is happening with the student, what is their level of education. Every, clear picture is there. And inspire students and parents to go for quality education. Because many times parents don't know what is quality education. If they send their child to school, they think their job is over. Many parents, because their children are studying at home with a mobile, they feel, what to do with the children. If they send them to school, they think they are in a safe place. But students and parents should know what is a quality education. So this has to be inspired and they should go for quality education. Improve the existing education system to meet their demands and needs. Okay, so we have demanded in many of these communities where there is no library, no proper school, and some schools are to be closed. They have really, demanded and brought the facilities they require. Provide adequate support for the needy students. Some students require some support. There may be a resource in their own neighborhood or in the nearby, so that can be provided to the children so that they can be supported and meet their challenges. It can be student-oriented rather than the goals of the nation or the world. Normally, government requires so many engineers, so many doctors, so many things. So they open up the, colleges. It is not about just taking some profession or making a living. Education is not just for living, But every child will have some kind of an ambition. They want to really do something in their lives. So how do you really support your child's ambition, their orientation, and everything is done, the whole education is focused on each individual child's desire to do what they want to do. So animator has to train the minister in identifying the needs of the students, prioritizing the quality needs in education, planning to present strategies to meet the demands, enrolling to motivate parents and students to go for quality education, and finally that approach the resources for grants and help. There is a lot of grants. A few years back we had 3,000 crore rupees granted for education, but all that was not utilized for more than 3 years, so that grants simply lost. It's because people are not aware. People don't know what to do with it. So it's not just having grants, but approach resources for grants and taking help is possible if every community has got a minister for quality education. Follow up and create success stories. Yeah. We have to see the whatever that we have taken up as a project is properly implemented, followed up, and the story is created, a success story is created. I'll give an example of a village where we have implemented this. There are about 25 to 30 children in that small village. They have got a small school, but the school was to be closed because there are hardly about 5-6 children going to the school. Some of them are not going to any school. Some of them are going to some other nearby city to study. So the local school is not having enough students, so they have to close. Once we made the children's parliament there, children took up this issue. They really, came forward, brought the awareness in their own village, brought the elders, and made sure that their children are brought to the school, and every child started going to the school, and the school is reopened. So this kind of success stories are to be created by a animator who is following up the minister for quality education, and then report success stories to be published in media. This is one thing we miss most of the time. We have so many good stories, success stories, but very few people are aware of it. So all these things, everything, any ministry, we have to make sure that we properly showcase them and presenting it to the world that this is a beautiful story, a success story about children. So with this, I will end my presentation of the 3 Sustainable Development Goals. If you have any questions, please.